Good evening, everyone. Today's topic is the basics of epidural hematoma and the subdural hematoma. So, first of all, we will start with the epidural hematoma. Epidural hematoma is a collection of the blood between the calvaria and outer periosteal layer of dura. Epidural means above the dura. So, in the diagram, you can see this is the dura mater, this is the dura mater, this is the epidural hematoma, and this is the calvaria. Okay, so it is between calvaria and the outer periosteal layer of dura. So source of bleed in epidural hematoma is middle meningeal artery. Next, very important is the shape of the hematoma. So basically it is a lentiform, means lens shaped, also known as biconvex shape, biconvex shape, or lemon shaped. Next, very important is as the EDH expand, it will strip the dura away from the inner table of skull. As you can see, this blue line is a dura mater. This blue line is a dura mater. This red is epidural hematoma. So it will strip the dura away from the inner table of the skull. This is a skull, and it will strip the dura away from the inner table of skull, forming the classic lens-shaped hematoma. So why it is biconvex shape? Because there is high pressure arterial bleed. There is high pressure arterial bleed in a limited space. In a limited space. That's why EDH is biconvex shaped. That's why EDH is biconvex shaped, because the space is limited and it is a high pressure bleed. Next, very important is EDH in adults rarely cross suture lines. Rarely cross suture lines. Next is subdural hematoma. The source of bleed is bridging cortical veins. Source of bleed is bridging cortical veins. And the subdural hematoma is between dura and arachnoid. Sub means below. Between dura and arachnoid mater. So you can see this light blue line is the dura. In EDH, there is stripping of the dura away from the inner table of the skull. But in case of the subdural hematoma, you can see light blue line is intact. Dura is still attached to the skull. And SDH shape is concavo-convex. SDH shape is concavo-convex, also known as crescentic shaped. also known as crescentic shaped, also known as moon shaped, or also known as banana shaped. So next, very important is SDH is concavo-convex. Why SDH is concavo-convex? Here it was a high pressure arterial bleed. Here it is low pressure venous bleed. Low pressure venous bleed. And second most important is it occupies subdural space. It occupies subdural space, which is a large potential space. Which is a large potential space. And the other thing is, as subdural hematoma is occurring in the subdural space, subdural hematomas will cross sutures. Subdural hematoma will cross sutures. Source of bleed in epidural hematoma is the middle meningeal artery. Source of bleed in subdural hematoma is bridging cortical veins. It is a high pressure arterial bleed which is happening in a limited space. That's why the shape of the EDH is lens shaped. And the shape of the SDH is concavo-convex. Why it is concavo-convex? Because it is low pressure bleed and it occupies a large potential subdural space. EDH in adults rarely cross the sutures line, while SDH will cross sutures because it is crossing through a subdural space. These are the CT images. First image is CT head showing a epidural hematoma. As you can see, it's a biconvex or the lens shaped. As you can see, it's a biconvex or a lens shaped hematoma. And very important in this epidural hematoma is the lucid interval is present. Lucid interval is present. So what is lucid interval? It is a period of time between regaining consciousness after a short period of unconsciousness. Initially, after the injury, the patient is unconscious. Then, for a short span of time, or there is temporary improvement in patient's condition, patients become conscious. And again, there will be deterioration after the onset of the neurological signs and symptoms which are caused by that injury. So again, patient becomes unconscious. So this is a brief period of consciousness is known as lucid interval, and it is very commonly seen in epidural hematoma. There is one more terminology known as talk and die syndrome, seen in epidural hematoma. After the injury, patient is unconscious, and for a short span of time, it is regained consciousness. After the deterioration of the neurological functions, patient becomes unconscious. So this short span of regain of the consciousness is known as lucid interval, and it is also depicted as talk and die syndrome. Next is subdural hematoma. The shape of the subdural hematoma, as you can see, is concavo convex. Why it is concavo convex? Because the subdural space is a large potential space. Because subdural space is a large potential space. And venous bleed is of low pressure. and venous bleed is of low pressure. Thank you.